Hello, good people. I'm coming to you today in the midst of the surge, and I'm here to thank you, but also to urge you to continue on. When I look at the numbers of our employee exposures and positives, the folks that test positive, I see that we're consistently below what's being experienced in the area around us and even in our own community. And that tells me that you have taken this seriously and are respecting the safety of yourself and others, and I want to thank you for that. You know, the pandemic has become politicized, and that's unfortunate. One thing's for certain, this is a communicable disease. And as I speak to you now, I know of at least one of our fellow employees who's in the hospital struggling for his life. I know of other employees, family members who are doing the same. And I personally know some who have passed away, as doubtless as you do. The greatest protection that we all have, we've learned so much since a year ago, is just modifying our behavior. It's simply wearing a mask, being socially distanced, being mindful of potential exposures. And it's taken its toll on people. So many of you, perhaps, mental health. I know my oldest son has taken it seriously. He wanted to go for a ride with a friend the other day, just to get out, do something different. But I don't know the chain of behavior that the other friend has had, and I've had to say no in protection of my family. I say that because it reaches all of us, and we just have to remain diligent in order to keep ourselves safe and others around us. That is why we have a policy that governs the wearing of masks in the workplace. As you go through common areas, as you go to and from the building. You know, there's not a long list of description because it's quite clear. If you're going to come in close contact with somebody else, you need to wear a mask. And this isn't a request, but it's a requirement. And we're doing it for your safety and for the safety of others. And when you do that, when you wear that mask, it's a pain, but you help model that behavior for others, and it's important. I do want to tell you that I've authorized the extension of the federal COVID leave that was granted late last year through the end of March. And staff is also working on a donated leave pool where employees can request additional leave should they need that. And the reasons for that is, again, safety. If you've been exposed, if you think you've been exposed, if you are showing symptoms, then you don't need to come to work. You need to stay home. And we want to be able to provide the financial assistance to do that for those of you that have. Some of you may be worried that you will catch it and want to bank your leave until you actually do get sick, and you might risk coming to work. So we need you to be mindful of what's going on with yourself and not bring it into the workplace. It affects others' safety and the operations and the delivery of services to our citizens. On the vaccine front, I want to thank some of you for assisting the Department of Public Health for standing up Clarke County's only vaccination site on Oneida Street. And that is in operation now. It's over in the Creature Comforts parking lot. And right now, as we speak, first responders, healthcare workers, and residents over 65 are receiving the vaccine. It started earlier this week. I have looked into this because I'm concerned for the welfare of you all, and I am convinced after reading federal documents that many, if not all of our workforce, all of you, would qualify under 1B, which is essential infrastructure, critical infrastructure workers. We don't know when your turn will come. I suspect, though, it'll be weeks away, not months, so I want you to pay attention. There's different access points for the vaccine. I would ask that you ask your doctor. There are a few pharmacies and physicians in town who have been approved to distribute the vaccine, and they would screen people there. So do that. Also, on the Department of Public Health website, you can register. I know that some of you are concerned about the vaccine for various reasons. We will have wellness incentives for taking the vaccine, as well as wearing masks. I urge you to get the vaccine when it's your time. If you're undecided and you wait, until 1C or 2 or whatever comes after that, there might be a sizable line for you to wait. So when your opportunity comes up, I urge you to consider to get it. I will also say It is a 95% effective vaccine as the FDA finds. If you choose not to take it, we can't extend this leave indefinitely. There'll come a time in the months to come where you've had an opportunity for the vaccine, and if you become sick after that opportunity, there may not be leave there to support you beyond what you have. This is a serious issue, but I'm encouraged by the love and care you've shown and demonstrated for each other throughout this pandemic, and I urge you to continue for both your safety and the safety of others. Take care.